When Medicaid was enacted in the mid-1960s, it held the promise of improved health care for people living in poverty in the United States. But the program was, and remains, as complex as the healthcare system itself. In response, a group of forward-thinking public interest attorneys founded an organization in the basement of UCLA that became the National Health Law Program, also known as NHELP. Our mission was, and still is, to protect and advance the health rights of low-income and underserved people. We challenge injustices and inequities to ensure that our national health system is accessible to all. Over the years, our work has expanded to include issues such as women's reproductive health and healthcare disparities. We advance our mission at both the state and local levels through litigation in the courts, education of other advocates, and the advancement of sound public policy in legislatures and agencies. We face many challenges in our goal of protecting and advancing the health rights of low-income and underserved individuals. Medicaid enrollment is up by nearly 9 million since 2007. Healthcare reform is under siege. States are slashing budgets and targeting healthcare. Our current objectives are to defend healthcare reform and to ensure that the rollout of the new law is successful. At the same time, we continue to safeguard individuals' health rights so patients aren't illegally denied quality health service. We work with clients ourselves, and we educate advocates in every state about the law. NHELP covers the entire country with a small staff of 18 lawyers. Our opposition may employ that many in a single case. Over the next decade, we hope to leverage our expertise and create a network of state NHELP attorneys to ensure that everyone has access to the care they deserve. Three things make NHELP unique. First, there's our legal expertise. Our lawyers are some of the best in the country, and our materials, especially our Advocate's Guide to the Medicaid Program, make complicated laws accessible and enforceable. Second, there's our network of legal advocates. Our 18 lawyers leverage their expertise by training hundreds of others to protect and advance the health rights of low-income and underserved individuals. We teach advocates about sound Medicaid policy, smart implementation of the health reform law, and how low-income women and children can access quality care. In 2011, we offered 131 trainings to advocates from every state in the nation. Third is our relationship with policymakers. Legislators and agency officials know us, trust us, and rely on our expertise. Thanks to our state networks, not only can we inform local advocates about national issues, but we also bring state-based information to federal policymakers. We're effective, first and foremost, because we are excellent at what we do. NHELP may not be a household name, but we've been called the preeminent Medicaid experts in the country, and advocates and policymakers know and depend on our work. We're also effective because we can take off our lawyer hats. For example, within weeks of healthcare's enactment, NHELP created a readable analysis of the law that is used by advocates nationwide working on health reform implementation. And we're effective because we leverage individual victories to help larger populations. For example, one client from Tennessee has muscular dystrophy. State cuts to home health services were going to force her into a medical facility, separated from her husband and 3-year-old daughter. When NHELP fought back on her behalf and won in federal court, we also helped hundreds of others in Tennessee keep their home health services. We evaluate and document the real consequences of our efforts using different metrics for different functions. We measure success not only by cases won and laws passed, but also by the people helped. Let me give you some examples. Our strategic litigation helps low-income and disadvantaged people obtain the health services to which they are legally entitled. In Washington, D.C., we were able to force the public release of guidelines to better ensure access to care for over 90,000 children. Advocates around the country use our guidance materials. In Florida, our Advocate's Guide to the Medicaid program helped convince a judge to order coverage of prescription drugs for over 50,000 people. NHELP responds to about 1,500 technical assistance requests from advocates and policymakers every year who use this information to help others. Last, we are active in over 20 coalitions. Our participation has caused other organizations and advocates to prioritize protecting Medicaid. NHELP recently commissioned a strategic assessment in which advocates, funders, and others familiar with our work were asked about their perception of NHELP. We were proud to learn that our work is held in high regard, but we also discovered that many did not know the breadth of issues we cover. People who know that we litigate may not realize that we also engage in federal regulatory work. People who know us as Medicaid experts may not know we are also experts in women's and children's health. People who know that we are actively consulted about ethnic and gender disparities in healthcare may not realize we also lead a state-based healthcare coalition in California. Our focus has always been on the work, not the credit, but it helps us to do our job better if more people realize how central we are to so many health rights issues. NHELP's major accomplishments fall in three major areas. First, in litigation, our work focuses on both individual representation and systemic reform. With local counsel, NHELP has successfully litigated most of the major cases in the U.S. involving the rights of Medicaid beneficiaries to quality health services. Second, in the policy area, NHELP has been deeply involved in the rollout of health reform, providing significant input to the Department of Health and Human Services on the design and content of the Medicaid expansion and the new exchanges from which currently uninsured people will be able to get quality coverage. Finally, there's our one-on-one technical assistance. By responding to about 1,500 requests a year for help understanding or enforcing the Medicaid and health reform laws, we help people get the health care to which they are entitled. In short, we're the lawyers people call when they need a doctor. The work we do is countercyclical. The more dire the economic climate, the more our services are needed. We're at a historic moment. There are remarkable opportunities because of health reform. At the same time, political pressure and the economic downturn are causing cutbacks to the very services that are so greatly needed. As a result, there's an increased demand for our services both on the proactive and on the defensive fronts. Our 18 attorneys are struggling to meet this increased demand and to maximize our impact. Because we have expertise both on the state and federal levels, and because health reform implementation is happening both in Washington and in all 50 states, our expertise is in even greater demand than it has ever been. We are creatively using technology, such as webinars, video conferences, to increase our impact. With more attorneys, we could do even more. NHELP trains and assists legal services attorneys who are a critical backstop against the erosion of health care rights for the most needy in our country. But legal services lawyers are jacks of all trades, not health law experts. Because the Medicaid and other safety net laws are so very complex, we can't just rely on lawyers who do health work part-time. We need a real coterie of attorneys who can ensure that the beneficiaries of our laws can reap their benefits. Our vision is a network of NHELP lawyers, one NHELP lawyer in every state, in addition to the 18 we have now working on the federal and state levels. Those state lawyers would help implement the best practices, learn about local realities, and train even more advocates. The network would ensure that real-world situations inform federal policymakers and that critical information is shared between states. There are two critical gaps we would like to fill. First, with implementation of healthcare reform, we'll see more people moving between state insurance exchanges and Medicaid as their circumstances and income levels change. These people may have health insurance through a state exchange, but are one paycheck away from Medicaid. They often also have other barriers to accessing quality health care. We'd like to expand our work to fill that gap. Second, we've seen an increasing need to address children's access to health care, including access to quality dental care. Nearly 1 in 4 children live in poverty in the U.S. today. Nearly 30 million are on Medicaid, and another 8 million are uninsured. Although other organizations advocate on behalf of children, there's a distressing gap in legal advocacy through litigation and training to ensure their right to quality health care is realized.